control is supposed to protect you, right? So why are so many people saying, no one told me this would happen? Welcome to Talk Health with Nurse P, and today we'll be talking about birth control and things no one really explained to you, right? That's what we're going to be discussing today. Now let's get straight to the point. Birth control isn't just one thing, right? It is a whole range of methods designed to prevent pregnancy, from pills, injection, implants to IUD. And here's the truth, no method is perfect. Each one comes with its benefits, risks, and trade-offs. There are several birth control methods that I would love us to be knowing before we now go and talk about the truth as it pertains to birth control. Now, number one method is natural method. This involves tracking your period naturally, like counting your cycles as it comes. When am I ovulating? When am I menstruating? When are my non-fertile days, right? Now, under this natural method, we have the rhythm method, the withdrawal method, the cervical mucus, where you use your cervical mucus to actually check if you're ovulating or not. And there's also using your basal body temperature to check if you're on your ovulation, because it is noticed that when a woman is ovulating, the body temperature becomes warmer than usual. Second method is the barrier method. Now this involves using physical blockage or physical methods to block the sperm from reaching the egg, right? So example, we have the male condoms, the female condoms, the diaphragm, the cervical caps, and the spermicide. Now spermicide kills the sperm before it reaches the egg, right? Now the next one we have the hormonal method, which is more like the most popular method people tilt towards, right? This uses hormones to stop ovulation or prevent fertilization. It releases hormones that would stop fertilization, right? Or stops your estrogen from rising, and also it can also stop your follicle stimulating hormones from acting, just so that you will not ovulate and pregnancy will be stopped, right? So example, we have birth control pills, we have injectables. There are some that you get to inject, there are some that are called the implants, right? Then there is the hormonal intrauterine devices. Now this one goes into the uterus, they are put into the uterus. Then there is the one that is called patches or the vaginal rings, right? Now there is a one that is long lasting. It is called long acting reversible contraceptive. Long-acting reversible contraceptive. Now the reason for the name, you can already guess, is that it acts for a long time. Some can act for a period of 3 to 5 years. Some can act for a period of 3 to 10 years, depending on what you want, right? This type of contraceptive lasts for years. Example, there's an implant that could actually last for 3 to 5 years. Now, how would you know these things? Now, how would you know? Notice that I have not mentioned any specific brand or whatever. Why? Because I don't want you patronizing roadside and drug dealers or walking into the pharmacy and requesting for one. I want you to walk into the family planning clinic, register yourself, let them know what you want, what you're trying to achieve, and the one that is suitable for you and the one you can afford, right? So we have the implant that lasts for 3 to 5 years. Then we have the IUDs that can last as long as 3 to 10 years, right? Now there is the permanent method. Now you have actually had your children and you're like, look, I don't want to have children anymore, right? And for us to be on the safe side, let me go through the permanent method. There is what is called the tubal ligation, where the fallopian tubes are being tied such that there will be no fertilization, because it is in the fallopian tube that fertilization occurs. So when they are tied, the sperm coming in cannot meet the egg that is coming out, right? Then there is the vasectomy. This is for the male, right? It's for the male, where the somatic cord is cut. It's a surgical procedure. Somatic cord is cut, that sperm cannot flow out during ejaculation, right? Now there is another popular one most people, especially young adults who are not even married, right, are engaging in, which is known as the emergency contraceptive. Now emergency contraceptive, there are some that can last, that act within 72 to 120 hours of usage, right? And then there is the copper UID that works within 5 days. It's as short as that, within 5 days, right? Now the most important thing to note when choosing a birth control method out of these 6 methods I've mentioned is that, okay, let's do a quick comparison between these. Now the methods, the effects, is it reversible or irreversible, and do they protect you from STI? Now for the natural method, the effect is low to moderate, right? Then it is reversible. You can choose to stop it, you can choose to go ahead, but it does not protect you from STIs. It does not protect you from STIs. Now the next thing is barrier method. Barrier method that we mentioned, use of condoms, diaphragms, cervical caps, and spermicide. Now, it has a moderate effect. Yes, moderate. Then it is reversible. But does it protect you from STIs? Only the condoms, which is not 100% protection, right? Yes. Now the next one is hormonal. Hormonal has a high effect in the body. It works very fast. It is reversible, does not stop you from having STIs. Then the long-acting reversible contraceptive is very high. In fact, very, very high. And yes, it is reversible and it does not protect you from STIs. Now, the permanent method is known as extremely high. Like the effectiveness is extremely high because there is no way you have done vasectomy. There is no way that you're going to have a child again. You have done tubal ligation. It cannot be reversed. You cannot say, oh, I don't want to do it again. So that's why it is extremely high, because when the spermatic cord is cut, you cannot join it back. Yes. If the fallopian tube is tight, you cannot unloosen it again. Right? Yes. And it does not protect you from STIs. Now, emergency contraceptive is high only if it is used early. That's why it is called emergency. And once it passes the stage of emergency, it is not effective. And yes, it is reversible. You can choose to stop it, right? And it does not protect you from STIs, right? So moving on, we'll now be talking on the first thing that they don't tell you when it comes to birth control. One thing is that you should know is that no birth control works the same for two persons, right? Because it works for this person, does not mean it will work for you. And your body may react differently depending on what you're taking, right? It can act differently from someone else. For instance, someone is using birth control pills and is gaining weight. You would use birth control pills and it may not allow you gain weight. It may actually reduce your weight, give you weight loss, right? Then it can cause birth controls can actually cause mood swings, weight changes, irregular bleeding, low libido, headaches, and for some people it can work perfectly fine. That's the thing. Birth control is not one size fits all. Birth control is not one size fits all. Like, they're not saying this thing, it has to work like this for everybody. Now, the biggest truth is that you may have to try more than one method, finding what works for you. For the people who are married or are trying to, control, they are married and they are trying to control the number of children they have, you would have to try several methods. And you're not just going to do this as a woman on your own. Your husband has to be involved, right? Nowadays, you may have to try more than one method before finding what works for you. And that's okay, because birth control is not just about preventing pregnancy. It is about your health, your comfort, your lifestyle, and your future, right? Now, what should you do before choosing any birth control? Ask question. Ask question. Meet the right persons and ask question. Ask question like, what are the side effects? Now, it's not all birth control that are effective for everybody. There can be birth control based on your health condition, right? Something that will not maybe spike up your blood sugar or reduce it, right? Something that will not expose your immune system to dangers, right? Or something that will not cause you to have hormonal imbalance. Yes. So ask question, what are the side effects? And how effective is it in real life? Like, how effective? Let's measure it. Is it a 99% effective? Is it 100%? Is it 50-50 chances of working, right? So you can also ask question, can I maintain this birth control method consistently? Because it is not today you're doing natural method, tomorrow you're switching to barrier method, next tomorrow you're thinking of emergency contraceptive or hormonal methods. Like, if I'm choosing hormonal method, can I maintain it consistently? And the next question you should ask is, does this birth control method actually fit my body and lifestyle? Does it fit my body and lifestyle? And most importantly, speak to a qualified health personnel. Speak to a qualified health personnel. Birth control is powerful, but only when you're informed. So don't just follow trends. Don't just choose based on what your friends are doing. Choose what is effective for you and what works for you. Now, just a little note for you. It has been found out that hormonal contraceptive contain carcinogenic agents. Listen very well. Hormonal contraceptive has been discovered by World Health Organization that it contains carcinogenic agents, that is cancer-causing agents, things that exposes your body to cancerous cells, right? So when choosing your birth control method, choose wisely. Let it be based on proper information. Take an informed decision. Don't just be very, very maybe try to pick based on what other persons are picking or what is popular or what you can afford, right? Pick what works for your health, right? Okay, with that, we'll see you in our next video. If you have any question, you have what you want us to discuss, feel free to drop in the comment section. If you're yet to subscribe to our YouTube channel, please do that now. Talk Health with Nospi. Turn on the notification button so you'll be the first to get notified when we post a new video. And like our post, drop a comment, share to your friends, share to every woman out there, share to every man out there. Let them take their reproductive health serious. We'd like to see you in our next video. Bye.